What is RHDV? Rabbit hemorrhagic disease virus is a member of the Calicivirus family. Other viruses in this family that do not cause rabbit health issues include norovirus, the most common cause of gastroenteritis, vomiting and diarrhea, in people, and a feline virus that causes respiratory disease. RHDV infects wild and domestic species of rabbits and is highly contagious. It does not infect people or other animals. The virus travels through the bloodstream of an infected rabbit and rapidly damages the cells of the liver. The liver makes proteins used in forming blood clots, and the classic form of RHDV causes uncontrollable bleeding in rabbits. Clinical signs of rabbits infected with this virus will primarily include bleeding from the eyes, nose, or mouth, as well as jaundice, yellow discoloration of eyes and skin, which are related to severe liver dysfunction or failure. Affected rabbits may also develop respiratory or neurologic symptoms, or even present with more generalized signs of illness such as lethargy, reduced appetite, and lack of defecation or urination. Additionally, some rabbits do not exhibit symptoms prior to succumbing to the disease. This outcome, known as sudden death, illustrates how rapidly the disease can progress, says Dr. Borsdorf. COVID-19 hasn't been the only global pandemic arriving on our shores recently. A new variant of rabbit hemorrhagic disease virus, RHDV, previously common in wild rabbits in Europe, Asia, and Australia, was first detected in the United States in early 2020. It has now spread to multiple states in the U.S., particularly the western states. On July 13, 2023, the first case of RHDV was detected in the state of Illinois in a pet rabbit. The case was in Cook County. Prior to this detection, the disease had not been diagnosed in wild or domestic rabbits. This detection raises the level of concern for the health implications of both wild and domestic rabbits within Illinois. If RHDV is detected or suspected in wild or domestic rabbits, it must be reported to the World Organization for Animal Health. One of the veterinary doctors, a board-certified specialist in zoological medicine at the University of Illinois Veterinary Teaching Hospital in Urbana, recommends that all pet rabbits be vaccinated against this new variant, RHDV2, which is more dangerous than earlier forms of the virus. This variant of RHDV has 70% to 100% mortality rates in pet rabbits. Its presence in Illinois emphasizes the need to act now to vaccinate and protect against this disease. How does RHDV spread? Unfortunately, the virus survives well in any environment. Infected wild rabbits may shed the virus outside, and the virus can then be carried into the home on people's clothing or shoes and introduced to pet rabbits. Any rabbit exposed to blood, urine, or feces of an infected rabbit could develop infection. Because RHDV is spread between rabbits, Dr. Borsdorf advises taking steps in your home to reduce the risk RHDV infection. 1. Do not allow your pet rabbit to graze in outdoor areas that are frequented by wild rabbits. 2. Ensure that shoes worn outside are not worn in areas of the home where your pet rabbit has access. 3. Weeds and flowers from outdoor areas frequented by wild rabbits should not be fed to pet rabbits. 4. Always wash your hands before and after handling rabbits. 5. Vaccinate your pet rabbit. The RHDV2 virus is very resistant to extreme temperatures. It can be spread through direct contact or exposure to an infected rabbit's excretions or blood. The virus can also survive and spread from carcasses, food, water, and any contaminated materials. People can spread the virus indirectly by carrying it on their clothing and shoes. Vaccination clinics for RHDV will be held on the following dates at Veterinary Medicine South Clinic, 2100 South Goodwin Avenue, Urbana. Clinic dates: August 18, 2023, September 15, 2023, October 13, 2023. Call for an appointment, 217-244-2555. The goal is to prevent this disease from impacting domestic and wild rabbit populations. To minimize the risk, here are some actions you can take to help. If you live near or visit an area where this disease was confirmed, do not touch any dead wild rabbits you may see. You may contact your local veterinarian, state and federal animal health officials to learn if RHDV2 has been detected in your area. If you see multiple dead wild rabbits, report it to state wildlife officials. If you own domestic rabbits, do not release them into the wild. If your rabbits appear ill or die suddenly, contact your veterinarian. If you volunteer at animal shelters or wildlife rescue facilities, be aware that this disease has been found in wild rabbits. If rabbits appear ill or die suddenly, contact the facility's veterinarian. Anyone working with rabbits should always practice good biosecurity. This includes basic steps like washing your hands before and after working with rabbits, and not sharing equipment with other owners. The virus is hardy and you need to be careful about how you dispose of a rabbit that has died. A carcass could be a means of spread of the virus. Contact your veterinarian or state or federal animal health officials for guidance. A vaccine for RHDV2 is not currently licensed in the US. Instead, it is up to you as the owner to protect your rabbits by practicing good biosecurity. Biosecurity means taking simple steps every day to keep germs away from your animals. These actions will significantly reduce the chance of RHDV2 or other contagious diseases affecting your rabbits. Follow these recommended biosecurity practices. Do not allow pet or wild rabbits to have contact with your rabbits or gain entry to the facility or home. Do not allow visitors in rabbit rise or let them handle pet rabbits without protective clothing, including coveralls, shoe covers, hair covering, and gloves. Always wash hands with warm soapy water before entering your rabbit area, after removing protective clothing and before leaving the rabbit area. Animal and Plant Health Inspection Service, June 2020. Photo courtesy of Canva 2. Do not introduce new rabbits from unknown or untrusted sources. Do not add rabbits to your rabbitry from animal shelters or other types of rescue operations. If you bring outside rabbits into your facility or home, keep them separated from your existing rabbits for at least 30 days. Use separate equipment for newly acquired or sick rabbits to avoid spreading disease. Sanitize all equipment and cages moved on or off premises before they are returned to the rabbitry. We recommend disinfecting with 10% bleach or 10% sodium hydroxide mixed with water. Establish a working relationship with a veterinarian to review biosecurity practices for identification and closure of possible gaps. If you are a breeder or grower who purchases live rabbits, even if you have existing biosecurity measures in place, you should review your practices and take steps to address potential gaps. Owners who have questions about this disease should contact their veterinarians. When found, this disease must be reported to the World Organization for Animal Health. Veterinarians should immediately contact the USDA APHIS area veterinarian in charge of your state or the state veterinarian if a case is suspected. For more information, contact the Emerging Issues team at U.S. Department of Agriculture. Animal and Plant Health Inspection Service. Veterinary Services. 2150 Center Avenue Building B, Fort Collins, Colorado, 80526-8117. bs.ceah@usda.gov or 970-494-7200. In other countries where RHDV circulates, vaccinations against the virus are given to pet rabbits. Now that the threat to rabbit health is present in the U.S., the U.S. Department of Agriculture has authorized emergency use of the vaccine here. Distribution of the vaccine to veterinarians began in 2021. Although the vaccine does not yet have full FDA approval, the approval process is ongoing. Preliminary research suggests that the vaccine is safe and effective in preventing infection. This is based on a challenge study performed where 100% of vaccinated rabbits survived when exposed to the virus, while 70% of the unvaccinated rabbits died from the disease. Side effects of the vaccine have included mild swelling at the injection site and mild fever or lethargy for a few days after the vaccine is administered. To be effective, the vaccine requires 2 doses administered at least 3 weeks apart, and annual boosters thereafter. Biological Medicine Service will continue hosting vaccine clinics to administer vaccines and their boosters to pet rabbits once monthly. Of days. Veterinary interns, residents, and students as well as certified veterinary technicians will be involved in this process under supervision of faculty members, including Dr. Borsdorf, head of the Zoological Medicine Service. Because the clinic is focused on delivering vaccine to healthy animals, no diagnostic testing will be performed at that time. Because of how the vaccine is packaged, vaccination will be offered only through the scheduled vaccine clinics and not through regular appointments with the Zoological Medicine Service at the Veterinary Teaching Hospital. To make an appointment for your rabbit to receive the vaccine, please call the Veterinary Medicine South Clinic at 217-244-2555. Cases of RHDV2 in North America. RHDV2 is highly contagious and, unlike other rabbit hemorrhagic disease viruses, it affects both domestic and wild rabbits. Many times, the only signs of the disease are sudden death and blood-stained noses caused by internal bleeding. Infected rabbits may also develop a fever, be hesitant to eat, or show respiratory or nervous signs. In February 2020, RHDV2 was detected in a domestic rabbit in New York City. The virus was quickly identified, isolated, and eradicated. There does not appear to be an epidemiological link, but the disease was later confirmed in a rabbit in New Mexico in March 2020. Since then, RHDV2 has continued to spread in New Mexico and across multiple states, including Arizona, California, Colorado, Nevada, and Texas. And please like, share, subscribe, and please don't forget to give your comments, and thank you all for your time.